You see them in the hospital, a blur of scrubs rushing through the halls, caring for patients and making critical decisions. But do you really know who's who? It's an alphabet soup of acronyms, CNA, LPN, RN, that can get confusing fast. What's the actual difference? And where do all those other titles like nurse practitioner or flight nurse fit in? If you're thinking about a nursing career, or you just want to understand who's doing what on a healthcare team, you're in the right place. We're about to break down everything you need to know about these roles, from how you get there to what you do and what you can earn. Welcome. As an experienced registered nurse, I've worked shoulder to shoulder with every type of nurse we're going to talk about today. I've seen firsthand how these roles lock together to form the backbone of healthcare. The world of nursing is built like a ladder, with each rung representing a different level of training, responsibility, and scope of practice. Getting a handle on this structure is the key to navigating a career in this field, or even just appreciating the teamwork that goes into patient care. Today, we'll start with the core roles: the Certified Nursing Assistant, CNA, the Licensed Practical Nurse, LPN, and the Registered Nurse, RN. We'll get into the weeds on each one, comparing their education, day-to-day work, career paths, and salary. Then we'll zoom out and explore the huge world of nursing specialties. Ready? Let's jump in. Certified Nursing Assistant, CNA. First up, the Certified Nursing Assistant, or CNA. CNAs are the foundation of hands-on care. In many places, they're the ones who spend the most direct time with patients, making sure they're comfortable and their basic needs are met. Education and training. Becoming a CNA is the quickest path into the nursing field. You don't need a college degree, which makes it a really accessible starting point. You'll complete a state-approved training program that mixes classroom learning with supervised clinical hours. These programs are fast. You can often finish in just 4 to 12 weeks. After that, you have to pass a state certification exam. It's got a written part and a practical, hands-on skills test to prove you're ready for the job. Scope of practice and daily duties. CNAs always work under the supervision of a licensed nurse, like an LPN or an RN. Their main job is to help patients with activities of daily living, or ADLs. Think of all the basic things a person does every day. This includes personal care, helping with bathing, getting dressed, grooming, and using the restroom. Mobility, helping patients get out of bed, move around, or transfer to a wheelchair. Nutrition, assisting with meals and keeping track of what patients eat and drink. Basic medical tasks. They also do key support tasks like taking vital signs, blood pressure, heart rate, temperature, and recording them. A huge part of a CNA's job is to be the eyes and ears of the team. Because they're with patients so much, they're often the first to spot a change, whether it's a new rash or just that a patient seems more confused today. They report these findings straight to their supervising nurse. It's just as important to know what CNAs can't do. They don't give medication, perform invasive procedures like starting IVs, or create patient care plans. Their role is supportive and task-oriented, but it's absolutely vital. Career growth and salary. Many people use the CNA role as a launchpad. It gives you incredible real-world experience and a clear look at what a healthcare career is really like. A lot of CNAs go on to become LPNs or RNs, and that hands-on experience gives them a massive advantage in nursing school. As for pay, the national average salary for a CNA is around $41,270 per year, or about $19.84 an hour. This can shift based on your location, experience, and where you work. For example, CNAs in hospitals or government jobs often earn more than those in assisted living. The CNA role is tough, both physically and emotionally, but it's where the heart of nursing truly lies. Licensed Practical Nurse. All right, moving up the ladder, we have the Licensed Practical Nurse, or LPN. You might also hear the term Licensed Vocational Nurse, or LVN, which is what they use in states like California and Texas, but the job is the same. LPNs are the critical link between CNAs and RNs, with more advanced clinical skills and a wider scope of practice. Education and training. The path to becoming an LPN is a bigger time commitment. You have to complete a practical nursing program, usually at a community college or technical school. These programs take about 1 to 2 years and end with a certificate or diploma. The coursework is much more in-depth than a CNA program, covering anatomy, pharmacology, and other advanced skills. Once you graduate, you have to pass a national licensing exam, the NCLEXBN, to get your license. Expanded scope of practice. LPNs provide what's known as basic nursing care, working under RNs and doctors. Their role is a major step up in responsibility from a CNA. Here's what an LPN can do that a CNA can't. Administering medications. Asterisk, this is a huge one. LPNs can give many kinds of medications, including pills and injections. Performing treatments. LPNs are trained to perform wound care, change dressings, and insert urinary catheters. In some states, they can even start IV drips. Monitoring and data collection. While CNAs take vitals, LPNs do more detailed patient monitoring and collect data that helps the RN make decisions. But there are still limits. The biggest difference between an LPN and an RN is that LPNs generally do not perform comprehensive patient assessments or independently create a patient's care plan. Instead, they contribute to the plan by collecting data and reporting their findings. The LPN's job is to help carry out the care plan the RN has put in place. Career growth and salary. The LPN role is a solid career, and many use it as a bridge to something more. LPN to RN bridge programs are very popular, allowing working LPNs to earn an associate's or bachelor's degree in nursing much faster. Financially, it's also a step up. The median salary for an LPN in the U.S. is around $62,340 to $64,150 a year. Just like with any nursing role, this varies with location, experience, and the type of facility you work in. LPNs are the versatile implementers of the nursing world, playing a crucial part in putting the daily treatment plan into action. Registered nurse. And that brings us to the role most people think of when they hear nurse, the registered nurse, or RN. RNs are the clinical leaders of the healthcare team. They're the decision makers who are responsible for assessing patients, creating care plans, and supervising LPNs and CNAs. Education and training. To become an RN, you need a college degree in nursing, and there are 2 main ways to get there. 1. Associate degree in nursing, ADN. This is a 2-year degree, usually from a community college. It's the faster track, focusing heavily on the core clinical skills you need to work at the bedside. 2. Bachelor of Science in Nursing, BSN. This is a 4-year degree from a university. A BSN program covers all the same clinical skills, but adds courses in things like research, public health, and leadership. So what's the real difference? Both ADN and BSN grads take the exact same licensing exam, the NCLEXRN, and both earn the title of registered nurse. But that BSN is becoming more and more important. Many hospitals now prefer or even require a BSN, especially for specialty or leadership positions. A BSN often opens more doors for career growth into management or education. There's also a pay incentive, as BSN-prepared nurses tend to earn more over their careers. The broadest scope of practice. RNs have the most comprehensive scope of practice of these 3 roles. Their job isn't just about doing tasks, it's about critical thinking and managing a patient's entire journey. Key responsibilities include comprehensive assessment. RNs perform full head-to-toe assessments to figure out a patient's health problems. Developing care plans. This is a core RN function. They use their assessment to create a personalized care plan with specific goals and interventions. Administering complex care. RNs handle all kinds of medications, including high-risk IV drugs, and perform complex treatments. Patient education. A huge part of being an RN is teaching patients and their families about their health conditions and how to manage care at home. Collaboration and leadership. RNs are the hub of communication, working with doctors, therapists, and others. They're also responsible for delegating tasks to LPNs and CNAs and supervising their work. Career growth and salary. An RN license is a passport to a huge world of opportunities. The median annual salary for a registered nurse is about $93,600. With experience and in the right location, it's common for RNs to earn well over 6 figures. But the biggest growth comes from specializing or getting an advanced degree, which we'll get to in a minute. The RN is a clinician, an educator, a leader, and an advocate, all rolled into one. Now that we've broken down the roles, let's see how they fit together. In a hospital, CNAs, LPNs, and RNs aren't just coworkers, they're a deeply interconnected team. Think of the RN as the coach or team captain. They perform the initial assessment, analyze all the information, and create the overall game plan for the patient's care. They're looking at the big picture. The LPN is a key player who executes that game plan. They take the care plan from the RN and put it into action, giving meds, performing treatments, and collecting more data as they go. The CNA provides the essential, foundational support that lets everyone else do their jobs. They make sure the patient is comfortable and cared for, which frees up the LPNs and RNs to handle the more complex clinical work. Here's an example. A patient is recovering from surgery. The RN develops the care plan, which includes goals for pain control, wound care, and getting the patient moving. The RN then delegates tasks. They might ask the LPN to administer certain pain medications and perform the scheduled dressing change. The RN also delegates tasks like helping the patient get to the bathroom or assisting with meals to the CNA. While the CNA is helping, they notice the patient seems groggier than before and complains of new pain. The CNA immediately reports this to the RN. The RN then comes in, performs a new assessment, and might catch a complication that needs immediate attention. Every single one of these roles is absolutely essential. Without the CNA, nurses would be swamped. Without the LPN, the daily plan wouldn't get done. And without the RN, there's no strategy or clinical oversight. It's a system built on delegation, trust, and communication, all aimed at one thing: keeping the patient safe. Getting your RN license isn't the finish line. For a lot of nurses, it's just the starting block. The field of nursing is packed with different specialties that let you focus on a certain type of patient, a particular disease, or even a unique work environment. Let's look at a few. Specializing by work environment. Emergency room, ER nursing. ER nurses are masters of thinking on their feet. They thrive in chaotic, high-pressure environments, treating everything from a broken bone to a major trauma. You have to be adaptable and cool under pressure. Intensive care unit, ICU nursing. ICU nurses provide incredibly focused care to the sickest patients in the hospital. They usually have only 1 or 2 patients at a time, allowing for minute-by-minute monitoring. This specialty demands intense critical thinking and a deep knowledge of complex diseases and technology. Operating room, OR nursing, also called perioperative nurses. These pros care for patients before, during, and after surgery. You could be a scrub nurse, assisting the surgeon directly, or a circulating nurse, managing the entire OR. It's perfect for people who are meticulous and love a structured, procedural setting. Specializing by patient population. Pediatric nursing. These nurses work with kids, from tiny infants to teenagers. It's not just about treating small adults. They understand the unique developmental and medical needs of children. This job takes patience, a gentle touch, and great communication skills, especially with anxious parents. Geriatric nursing. On the other end of the spectrum, geriatric nurses specialize in caring for older adults. They manage complex chronic illnesses, work to maintain quality of life, and address issues like dementia and fall prevention. Oncology nursing. Oncology nurses care for patients with cancer. It's a tough field, but also deeply rewarding. They administer chemotherapy, manage side effects, and provide incredible emotional support and education to patients and families on a very difficult journey. Beyond the bedside, non-traditional nursing roles. Not all nursing happens in a hospital. An RN license can be a ticket to some other really cool careers. Travel nursing. Travel nurses are RNs who take temporary assignments, usually 26 weeks long, at facilities around the country that have staffing shortages. It offers fantastic pay, with many earning over $100,000 a year plus tax-free stipends for housing and travel. It's a great way to see new places and get a ton of experience. Flight nursing, also known as transport nurses, these are elite critical care nurses who care for patients in helicopters or airplanes. You're basically running an ICU in the sky, stabilizing trauma patients, or moving critically ill patients between hospitals. It's a high adrenaline specialty that requires extensive ER or ICU experience and often pays over $94,000 a year. Nursing informatics. This is one of the fastest growing fields in healthcare. Informatics specialists are the bridge between clinical care and it. They help design electronic health records, analyze data to improve patient outcomes, and train staff on new tech. It's a perfect fit for a tech-savvy nurse who wants to make a system-wide impact, and salaries often exceed $100,000 annually. Legal nurse consultant, LNC. LNCs are experienced RNs who use their medical expertise in the legal field. They work with lawyers on medical malpractice or personal injury cases, reviewing medical records and serving as expert witnesses. It's a fascinating, high-stakes job with an average salary that can top $100,000. The pinnacle of practice. Advanced practice registered nurses, APRNs. For RNs who want to reach the highest level of clinical independence, the next step is becoming an advanced practice registered nurse, or APRN. These are nurses who have earned at least a master's degree and often a doctorate. They have much broader responsibilities and, in many states, can practice independently. The four main types of APRNs are: 1. Nurse practitioner, NP. This is the most well-known APRN role. NPs are trained to diagnose and treat illnesses, order tests, and prescribe medication. In many ways, they function like a primary care physician. 2. Certified Registered Nurse Anesthetist. CRNAs are the highest-paid nursing professionals. They are responsible for administering anesthesia and monitoring patients during surgery. It's a role with huge responsibility and requires incredible precision. The median salary for a CRNA is often over $200,000. 3. Certified Nurse Midwife. CNMs provide healthcare to women, with a special focus on pregnancy, childbirth, and postpartum care. They attend births and provide gynecological and family planning services. 4. Clinical Nurse Specialist. A CNS is an expert in a specific area of nursing, like oncology or pediatrics. They care for complex patients, but they also act as leaders and consultants within a hospital, helping to educate other nurses and improve patient outcomes across the board. A deeper look at nurse practitioner specialties. Just like doctors, NPs can specialize. Some of the most common specialties include Family Nurse Practitioner, FNP. FNPs are the generalists of the NP world, providing primary care to patients of all ages. Psychiatric Mental Health Nurse Practitioner, PMHNP. With a huge need for mental health services, PMHNPs are in high demand. They diagnose mental health conditions, provide therapy, and prescribe psychiatric medications. Salaries are very competitive, often averaging over $145,000 a year. Women's Health Nurse Practitioner, WHNP. WHNPs focus on the complete range of women's health needs, from routine gynecological care to obstetrics. Becoming an APRN is a major commitment, but it offers the most autonomy, responsibility, and earning potential in the nursing profession. As you can see, the world of nursing is so much bigger and more diverse than most people realize. It's a profession with a spot for everyone and a ladder you can keep climbing your whole career. We started with the CNA, the hands-on caregiver at the foundation of it all. We move to the LPN, the skilled clinician who puts the daily care plan into motion. And we covered the RN, the strategic leader who assesses, plans, and manages patient care. Each role is different, each is valuable, and each is a respected member of the team. From there, we saw how that RN license can be a launchpad into a whole universe of specialties. Whether you crave the adrenaline of the ER, the intensity of the ICU, the adventure of travel nursing, or the analytical challenge of informatics. And for those who want to reach the very top of clinical practice, the APRN roles, NP, CRNA, CNM, and CNS, offer a chance to lead and shape healthcare in profound ways. Nursing isn't just a job. It's a dynamic, always evolving profession with a role to fit any passion, for anyone with a desire to care for others. I hope this breakdown was helpful, whether you're a student trying to figure out your future or just someone who is curious. Now I want to hear from you. What part of the nursing journey are you on or most interested in? Are you a CNA, LPN, or RN right now? Are you dreaming of becoming a flight nurse or a nurse practitioner? Drop a comment below. I love seeing the goals of this amazing community. If you found this video valuable, please give it a thumbs up and subscribe for more deep dives into the world of nursing. And don't forget to hit that notification bell so you don't miss what's next. Thanks for watching.